Sangamon County, a report said Sangamon County ranked badly, 80th I think, for unhealthiest counties in the state of Illinois a few months ago. And I think at least the SIU Medical School and certainly the Citizens Club, who are co-hosting the program this evening, kind of got together a little bit and said, how could that be so? So we have decided to have a presentation this evening. We will start with a main presenter, and Dr. Stewart will introduce her. We will have a special panel following that presentation. And so at this time, I'd like to introduce Dr. David Stewart, and I have a hard time seeing the light up here. David is the Associate Dean for Community Health and Service at SIU Med School. Been with the med school some 35 years. Received undergraduate Master of Public Health and medical degrees from the University of Iowa. Dr. Stewart.
Thank you all for being here. Thanks to the Citizens Club for co-sponsoring this event with the School of Medicine. It's a pleasure for me to introduce our guest tonight, Dr. Julie Willems Van Dijk. Dr. Willems Van Dijk is an Associate Scientist at the Population Health Institute at the University of Wisconsin School of Medicine and Public Health. In that role, she is the Deputy Director of the County Health Rankings and Roadmaps Program, which was the organization that issued the report that Ray just referred to. So we're all eager to hear from Dr. Willems Van Dijk about that program and how we might respond to it.
Well, thank you all for such a warm welcome on a frigid evening in Illinois. I told everybody I was going south to escape. I think it's below zero in Madison, so anyway, I really am pleased you all came out this evening. I have the great privilege of being the voice of the County Health Rankings and Roadmaps, but I stand on the shoulders of an incredible team. Many of you are probably familiar with the Robert Wood Johnson Foundation. They are the largest foundation that supports health and healthcare in the United States. And in fact, this morning, their president, Dr. Risa Lavizzo-Moret, issued her president's address to talk about the next 10 years the Robert Wood Johnson Foundation will be supporting a culture of health. So it seems so appropriate that this evening we're here to talk about how to create a culture of health in your community, or how to continue to build one, because I know much good work is already underway. I also take no responsibility for our beautiful website or all the data on it. That is the people you see on that team here. I'm the one who gets to come out to communities and talk about how you translate that data into action. And that's really what we're here about tonight, is to take a look at the model and the data that resulted in your county being ranked 80th in Illinois, so that we can understand it, so that you can then think about what are good next steps for us to take, or what things are we already doing that we should keep doing in this community, and where might we also be able to refine our activities or add activities to improve our health status. So, and I will do that in the next 20 minutes or so, and then we'll have an esteemed panel join us to further reflect on these findings and on health in your county. But I wanted, one of the things that people asked me about before I came is, well, is anybody else doing this? Are there places we can learn from? And there are a number of places throughout the nation that are doing this work, including 6 communities that were the recipients of the RWJF Roadmaps to Health Prize last year. And so I thought, rather than just having me talk at you for 20 minutes, that we take the first 2 minutes and hopefully, if technology works here, show you and demonstrate voices from 6 communities that are on their journey towards health that I think might have some clues for us.
Winning the Roadmaps to Health Prize is a validation of the work that we have done as a community. The way we've done our work here really is a roadmap.
It's also an opportunity for us to build on the work that we're doing.
People from outside our community are saying that the work we're doing matters.
We have something to offer, even beyond ourselves, to teach people where we've come from. It inspires our community to be confident in themselves.
I am extremely optimistic about the future of our health. Our students harvest the food from seed to table.
We've worked on improving the school breakfast.
When kids are healthier, their learning sparks.
They really feel excited about physical activity.
We're trying to focus on factors like literacy that people don't generally associate with health.
We've made a concerted effort to address the issues of health disparities.
The focus of our work is helping people who have committed crimes to re-enter society, to contribute to their families and to their own health.
So our focus is absolutely closing those gaps between haves and have-nots.
The key is fostering the kind of multi-sectoral partnerships.
We've been able to bring together a coalition that doesn't look at just one problem.
One of our major goals in addressing health disparities is improving access to health care in some of our poorest neighborhoods.
We can achieve many things together that none of us could achieve alone.
That's something that gives me lots and lots of hope.
So, in listening to those stories, what did you hear? What were they doing? They were what?
I heard we.
We, yes, they were working together. Really important point. Anything else? Yes?
I kept hearing health, I didn't hear health care.
Yes, yes. That was a really astute point. Anybody else?
Everybody was active.
Everybody was active. Even the guy in Minneapolis riding his bicycle in the snow. So, yeah, and if you want to learn more about those communities, on our website, countyhealthrankings.org, there are 4-minute videos about each of the communities that dives into greater detail about each of them. So, one of the things I want to start with is we're not here to rank you and spank you. We are here to inspire hopefulness and action. And that really is what the County Health Rankings is about. We take data that other people have collected. We don't collect any of it ourselves. We put it together in a way that displays it in a ranking format so that our friends in the media will pay attention to it and draw attention to this so that community leaders and members like you will come together and ultimately implement evidence-informed policies and programs to improve health. So ultimately, the County Health Rankings is about being a call to action. And let's spend a few minutes talking about the rankings themselves, because you don't want to be called to action unless you really understand what the data is, what it says, and whether it really makes sense. Because many times, the first thing people say to me is, yeah, I'm not sure I believe that report. That doesn't make sense. In fact, the mayor of Kansas City, Kansas said to me when his public health officer brought the report to him, he said to him, how can that be? We have the KU Medical Center in our county. There are counties in Kansas that don't even have a hospital. How could we rank poorest in health? And here's what Mayor Reardon learned after studying the rankings and thinking about what creates health, is that this model, which might be a little blurry to you out there, but I'll tell you what it says, is that in order to have long life and healthy life, which is what we see in the green bars at the top, length of life and quality of life, you need to focus not only on access to and quality of clinical care. That part contributes about 20% to your health. But you also need to think about what are we doing about environments that help support people in making good healthy choices. much they move, around what they eat, around whether they smoke, how much they drink. We need to think about social and economic factors, which actually contribute the most to health. So what are we doing to support children in getting a good education, graduating from high school, being ready to go on to post-secondary education? What are we doing about creating good jobs in our community that pay a living wage? And what are we doing about creating safe, connected neighborhoods where people can count on each other and feel secure and emotionally healthy? And what are we doing about our physical environment? How are we protecting our air and our water and creating environments where it's easy to get out and bicycle, even when there's snow on the ground? So we produce this report, the County Health Rankings. We release it every year. The good news is that there will be new data about a month from now. March 26th will be the 5th annual release of the County Health Rankings. And we release it every year to continue to shine this spotlight on health in your community. I like to tell people it's like your community's annual physical. You go to your physician every year and have an annual checkup. You go to the County Health Rankings and get an annual checkup of your community's health. And it's an opportunity to stop each year and say, well, let's see how are we doing, and then let's think about how we can do even better. So at the County Health Rankings website, which I just showed you, which is countyhealthrankings.org, so when you go home tonight and you want to learn more, everything I talked to you about is right here and in a fairly intuitive, easy way to navigate through the website. So you'll see that map of the United States. All you need to do is click on the state of Illinois, and you will come here. And I know, again, it's too small to read, but what you see very quickly is the lighter colored counties in your state are the healthier counties, and the darker the color green, the unhealthier in terms of those measures of today's health, how long you live and how well you live. Then you can click and look at the health factors, and this is your state looking at those measures of what I like to refer to as tomorrow's health, those measures of clinical care, of health behaviors, of social and economic factors, and of the physical environment. Now you'll notice, if I flip back and forth between these, they're not exactly the same. Some places in your state aren't doing as well here, but particularly in the central part of the state, they're doing better in the health factors. And I often tell people, if I were going to choose which I wanted to be better, I want to be better in the health factors, because that's predictive of what's coming next. So, then, if you click on either the name of your county in the list or your county on the map, you get to all of the specific data that describes Sangamon County. So on the website, this would just scroll down. But on the first slide here, we have the data about health outcomes. And what you see in the first column is the data for your county. The next column is the error margin. And this is the 95% confidence interval for those of you who are statisticians. But for those of you who are not, it's just like when they do presidential polling and they say one candidate is up over the other plus or minus 5 points. This is your plus or minus 5 points. The next column gives you data for your state, the mean for your state, and then the last column of data provides a national benchmark. And that national benchmark is the 90th percentile of all the counties in the United States. So we take all 3,141 counties, we line them up, and we say, here's where the A students are. So it gives you a point of comparison to the mean in your state, but also to the best performers across the nation. Now, I'm not live on the website now, but I know a few people were saying they wanted to know about specific pieces of data. And if I were live, I could hover over any one of those measures that you see in blue, and it would tell you exactly what that is. Most of these things are reported in rates, or so many of these per 100,000 people in your community. The reason public health people like us use rates is that allows us to compare a county that has 185,000 like yours to a county that has maybe 10 or 20,000 people. So you can see, again, this is the number that you keep hearing about. In terms of health outcomes for the health of people today, you rank 80th out of 102 counties in Illinois. If we move on, though, to the health factors, you are doing better. So you rank 42nd out of 102 counties. And so what I think that indicates for you is there are many people who are aware of these issues in your community that have already started to work on them, and that you are starting, hopefully, to see some progress in some of those areas that determine health. But still at 42nd out of 102, there's a ways to go and room for improvement. In fact, last week I was in Wake County, North Carolina, which is the healthiest county in North Carolina, and they had the same attitude. Well, we might be first in North Carolina, but we want to compare ourselves to every other capital county in the United States and be the healthiest among them. So watch out, Sangamon County. Wake County, North Carolina is after you. So again, I know the slide is probably too small for you to see, but if you go and look at this, you'll be able to compare areas where you're doing better and where you're not doing as well. Now, here's the deal. I'm from the University of Wisconsin in Madison. I don't know Springfield. I don't know Sangamon County. I don't know which of these pieces of data ring true to you or which make you scratch your head and say, I wonder where they got that and that. I never thought about that before. And that's exactly what we want you to do. We want you to scroll through this list and look at it and say what makes sense, what doesn't make sense, and where do we need to know more. And so one of the other pieces of resources we have on our website is something called Using the Rankings Data. And what this will do is you can take it and look at your county snapshot, which is exactly that, just a snapshot of some pieces of data about your community, and dig deeper into understanding more about your community. This will take you to data that's available through your state Department of Public Health. What it doesn't take you to is some other rich sources of data in your community. And I know that through the Community Health Needs Assessment that Mercy Medical Center has done, they have put data, more local data available to your community through a partnership with a company called Healthy Communities Institute that's available to you, for you to look at, and that's available on their website. So lots of places to dig down and look deeper. But again, as we look at the data and we think about it, and we think about where there's opportunities for improvement, it's really about how do we bring people together to do that. So it's not simple enough to say to the medical school, well, you take care of that, you're the medical school. Or to your hospitals and say, well, you guys take care of that, you're the clinical providers. Or to your public health department and say to them, well, you're the population health folks, you should fix this. Because we know that it takes everybody to influence those multiple factors of health. So we need our employers, we need our elected officials, we need our educators, we need philanthropy, we need community citizens coming together and thinking about how we take action to improve health. And so this take action cycle, I say, is equally important as that model of health that I showed you earlier. So when the Robert Wood Johnson Foundation first released this report back in 2010, there was no roadmaps. There was nothing to help communities with how to take action. And guess what happened? They released the first county health rankings and their phones started ringing off the hook, as did ours at the University of Wisconsin, with people saying, all right, we got it. Our health is not where it should be, and therefore we want to take action and we want to know what to do next. And so that's where we have developed these additional tools and resources to help guide communities. And here are a couple of foundations of what we think about with the roadmap to health that I'd like you to consider as you think about what you do next. First of all, one I've already mentioned, it takes everyone. This is an effort that the community must get their arms around in order to influence all of those important areas that influence health. Second, the right side of the wheel talks about assessing and planning, and you have done that work in your community. Both of your hospitals have completed community health needs assessment. Your public health department completes a community health needs assessment every 5 years. And as happens in many communities, that's where people get stuck, is on the planning side of the take action cycle. So what really is before you today is how do we move into action, and how do we move into even more effective action? And that the third point is that you want to attempt to use evidence-informed action. There's a lot more we know about what influences community health today than we did 10 or 20 years ago. And yet, relatively speaking, I'll also tell you it's a pretty new area of study. And so there's also more to learn. So I think it's really helpful to think about what do we know is working in other places, but I also think you're your own little laboratory where you could develop new ways to think about how to improve healthy eating and active living, how to get people to quit smoking, how to improve your high school graduation rate, how to lower the number of low birth weight babies being born in this community in ways that other communities haven't yet envisioned. If you really want to influence those ultimate health outcomes, how long you live and how well you live, it's important to think about action across all of the health factors. Because you already know being second in the state in the quality and access to clinical care isn't enough to make you the healthiest county in the state. And so working across health behaviors, thinking about social and economic factors, thinking about your physical environment, and then not just thinking, but taking action to move forward. And then finally, programs are good, programs that encourage one child to eat better or one child to move more, but you also want to think about not only how you do things at the individual level, but how you can change systems, how you can make your school system more welcoming of physical activity and integrate that into the day-to-day activities, how you can change your physical environment to make it easier for people to move, how you can work with your chamber and your business leaders and your local elected officials to bring good paying jobs into your community. So thinking about both things that influence individuals today and tomorrow, and what we can do in the long run to influence change. So one tool that I'm going to quickly introduce you to before we wrap up here is, as I mentioned, we have our Action Center, and one of the tools that we have is a tool called What Works for Health. And what we have done is done a literature review of each of the different key areas that you see in the health factors. So for example, tobacco, alcohol use, diet and exercise, and right on down through access to and quality of medical care, education, employment, community safety. And we have rated the evidence in for each program or policy on a scale that is from scientifically supported, that says there's many, many studies, to some evidence, to expert opinion, to insufficient evidence. This looks like it might be a promising idea, but we don't yet know if it works very well, to mixed evidence. Some studies show it works and some studies show it doesn't, to evidence of ineffectiveness. And so for one example here, if you were looking at diet and exercise, you could click on here, and you would see there's 45 results of different policies and programs that we have found to have some effectiveness in terms of diet and exercise. One of those, at the bottom of the page here, that's scientifically supported, is competitive pricing in schools. And if you clicked on that, you get to a page that tells you a lot more about what does that mean, what is the evidence, what does it actually say, and where are some examples of toolkits or resources for how you can implement that policy and programs. For those of you who are wondering, competitive pricing in schools is where you make the salad bar really cheap and the hamburger and french fries really expensive. So you kind of try to price kids or employees. This works very well in work settings too, into healthier choices. So as I wrap up, and think about those healthy communities that we were talking about at the beginning. Here are some of the things that we saw as we looked across those healthy communities. And I have spent half a day in your beautiful city and county, and I think some of these elements are well seated in your community. People care deeply about their communities and are not afraid to show it. They're very positive. They might say we're 80th, but we're going to make ourselves better. And I give yourselves a pat on the back for the fact that on a cold February night, this room was full of people who want to see about what this means and how we can make our community better. Leadership centers on bringing and keeping people together. Moving your community to a healthier place is not going to happen overnight. It is hard work. It does require continuous attention. Many of these communities had young people leading because, let's face it, that tomorrow's health is their health moving forward. And they bring optimism and fresh ideas and energy and tech knowledge, which are all really great things to have. Partnership means relationship. When I go to communities that are doing this, people are not exchanging business cards at the table. They know each other, they respect each other, and they really work well together. And there's meaningful engagement of the community, including communities most affected by disparities of health. People who live in low-income neighborhoods, people who have less education, people who are of ethnic minorities in that community, people who speak a different language than English, and really listen to the people who are affected by these health issues in a really genuine way, and include them in leadership in helping to solve the problems. So it's not about what we need to do to fix those people. It's about how we embrace communities and all people as citizens of our community and how we move them forward. A few other things that I've already mentioned. The focus on policy systems and environmental change, a really important one. They focus first. They decide what it is they want to do, and then they figure out the resources, rather than saying, well, we could never do that, we don't have the money. Because when people are really clear about what it's going to take to move health forward and generate enthusiasm and buy-in, there often are ways that they can find the resources to make that happen step by step. They measure their progress towards making a difference. And we had a session this afternoon, and we know measurement's tough, and it's not easy, and it's not perfect. Let me tell you, the county health rankings are not perfect. But it is keeping your eye on that prize and continuing to move the needle forward. And finally, the whole is greater than the parts. And a lot of what I mean by that is that nobody cares about who's getting the credit. That it's really about how we work together to benefit the whole community, rather than any particular organization being seen as the one that gets the credit. So, I want to thank you again for coming out on a frigid evening, and I want to welcome our panelists to come up and tell us more about health here in Sangamon County.
Thank you very, very much. We have a panel of very outstanding local personnel. So if I could ask Jim Stone and SIU Kirzinger and Dr. Dorsey to come up. Didn't want them to break their necks while they were trying to look at the visuals. Dr. Kevin Dorsey has been Dean of the SIU School of Medicine for 12 years. Dr. Dorsey received a Ph.D. in biochemistry from the University of Wisconsin. Postdoctoral work in biology at Johns Hopkins University and an MD from the SIU School of Medicine. Dr. Ashley Kirzinger is the Director of the Survey Research Office in the Center for State Policy and Leadership at UIS. She received her Ph.D. from Louisiana State University and has been in her second year here in Springfield, where it's a lot colder than it was in Baton. Jim Stone is the director of the Sangamon County Department of Public Health. And what we'll do, each will take a few minutes here at the podium and discuss a little bit of their involvement. I know there's been meetings going on. Then we'll bring Julie and Dave back up, and we'll try to do a few questions from the audience before we get out of here. So at this point, we'll start with Jim Stone.
Good evening. I'm particularly happy to have Dr. Willems Van Dijk come tonight because every year when these rankings come out, it's our department that the media finds. So thank you for that. But what I like about tonight is we do have some of our media here, and we have a chance to talk a little bit more detail about how these rankings involve so many various facets of our community that are never discussed, that two and two are never put together. And so I think that's probably one of the most interesting aspects of this tonight. I have to kind of smile though every time we get statistics or information back. I harken back to a comment one of my professors told me when I was getting my master's degree in biostatistics, and he said, you know, just remember, there are lies, there are damn lies, and then there are statistics. And then the next thing he followed up with was, always look for the bias. And I'm thinking, this is not a good opening to this class. But as I got to learn where he was going with these comments in the beginning, it made me understand that just as community health rankings gathers data, just as they go back over a period of years to kind of smooth out peaks and valleys, it's important for us, all of us, in these positions of authority, when we're looking at these kinds of rankings, to take a look at various sets of data, see where the commonalities might be, see if there's something that stands out to us that somebody else is doing that maybe we could do, or we're already doing, or maybe even do it better. So I think that's what's important about this kind of discussion tonight. I'll leave you with one aspect of what we're trying to do at the county health department. Some of you may know that with the ACA requirements, hospitals are now required to do their own assessments every 3 years. As Dr. Willems Van Dijk mentioned, county health departments to be certified in Illinois must do what's called an IPLAN, Illinois Project for Local Assessment of Need, every 5 years. Well, this community, and I've pretty much lived here my entire life, born and raised in Williamsville, we have a wealth of knowledge. We have a wealth of services. We have a wealth of agencies, a wealth of people who love this town and love this county and want to do the best to help our community. But for some reason, we all tend to, from time to time, operate in our own silos. We don't seem to just pull it all together. I think there have been great efforts. There are some that are active right now in our community. They're helping us move in that direction. But when we saw this requirement and we looked at what we have to do, we kind of stepped back from it and said, look, we've had lots of different assessments for health in this community by various agencies. We've been a part of a lot of those. Some of them we have led. We have to stop reinventing the wheel. So we approached the State Department of Public Health, and we asked them, we would like to be a pilot project for you. Went to Tom Spurgeon. He's a gentleman who actually evaluates all the IPLANs for all the health departments in the state. We said, Tom, we would really like to use the input from our respective hospitals because they're bringing together the same people, the same leaders, the same agencies, all these various walks of life in our community, gathering their input and then coming up with their own plans. Why can't we take that and pull together and do it together? And you know what? We'll even volunteer to do it every 3 years just like they have to. We'll do it more often than is required to keep our certification. I think that piqued their interest. They're not used to somebody doing more than what they have to do. So they agreed to that. And we actually, through that process, in one big meeting in one day, sat down with the hospitals. We invited Tom to come sit right there. So we had no hidden agenda. We wanted him to know exactly how the exchange went. It went very well. I had to see Tom in the audience, and so glad he's here. But it went very well. And we thought, you know, this is what we need to do to move forward in this community, is to gather this as a process. I think it was well received by the hospitals as well. We'll continue to do that and move forward. We realize they have a little bit of a different dictate as far as the IRS mandates. But you know what? There's a way we can make this work. And hopefully by, again, the health department that's somewhat built on not duplicating services can work together to pick its niche in this county to help us improve our health overall. So I think I'll just leave it at that. Tom?
Good evening, everybody. Can you hear me? I'm short, and I feel like standing on my tippy toes. There we go. As Bob said, I'm Dr. Kirzinger. I run the Survey Research Office at UIS, and I am not an MD, nor do I have a background in health research. So I think that's what allows me to bring an interesting perspective to this panel tonight. First off, I want to commend the county health rankings. Anytime that you have data, I love data. It's my life. It's what I live for. I'm the dork in the back room playing with data sets all day, and I love it. So anytime that an organization will aggregate different sets of data and allow the community and the nation and people that are interested in this type of thing to actually analyze the data, I commend it. And I think it's a really interesting project. I would also encourage you, if you're interested in this sort of thing, to look at Memorial's Healthy Communities website, because they have done an excellent job of aggregating even more local data if you're interested in examining Sangamon County health data. In addition, yes, there are lies, damn lies, and statistics, but I think one of the things we want to caution about is that anytime we get these type of statistics where it looks like we're not ranking as highly as we would like to be, we immediately go, oh, there's something wrong with the data, right? We get a little defensive, and I would encourage us not to get too defensive, because there's some really interesting stuff in here that we're doing really well. Ranking second in quality of care is excellent, and that is the direction we want to be headed. We know that we have great hospitals here, we have great clinics, we have great healthcare practitioners here, and so the fact that we're doing that really well and we're ranking so highly is a great sign. In terms of the health outcomes, yes, we're not doing as well as we would like to. The majority of that data is actually drawn from a survey called the Behavioral Risk Factor Surveillance System Survey. It's a national survey. I used to actually run it down in Louisiana, and we didn't do well down there either, so don't worry. Some of the rankings that they look at that I think that would be interesting to talk about tonight is the first would be they ask people if there was a day in the past 30 days that you were felt physically unhealthy. If there was a day in the past 30 days that you felt mentally unhealthy. If there was a day that you were kept from your usual activities because of poor physical and mental health. We are not ranking highly in those, according to the BRFAs. Now, in the citizen survey, we asked the same questions because we wanted to look at it more recently. And we're doing a little bit better than we were. The BRFA's data that's included in this report is most recently about 2010, 2011. So our 2013 data shows that we're doing a little bit better in those categories, but we still could have ways to go. What's most concerning is that there's a certain segment of our population that tends to be doing the worst in these categories. These are the people that are uninsured. About 11% of our population in Sangamon County is uninsured. These are people with, that have food insecurity in the region. They're located in regions where there's food deserts, which means that they don't have access to high quality food in their area, and they don't have the transportation to go and get it. These are people that don't have a primary care provider. They don't have a physician that they know that they can go and call, so their first place that they go when they get sick is the emergency room. And we know that that is not the criteria for good health care in their region. In addition, these are people, we ask them about their ability to understand directions from their healthcare practitioners. And we found that a fairly high percentage of our low income and low education residents in Sangamon County don't understand the directions that they're given from their physicians, which is problematic. Of course that will lead to poor health care, especially if they can't even manage the directions from their physicians. So I'd encourage you to look at this data, but realize that there are discrepancies, and that's where we can really focus our attention. And I know some agencies are doing it really well. I know that the United Way has worked with the Chamber of Commerce and the Community Foundation to really identify these population groups and help. In addition, Memorial with their healthy communities, I've had multiple conversations with the staff over there, and they are very committed to making sure that we are addressing these at-risk population groups. And finally, I had just a meeting last week with Gen H, which is working on getting quality food inside our schools. And so I think those are programs that are working really well, and we just need to encourage these agencies to work together to continue this type of work in the region. As Bob said, I've only been here for a couple of years, actually not even 2. I've only been here for about 18 months, but I have been pleased with how much attention this type of issue is getting in the region. And I think that yes, we should be skeptical of the data, but we should embrace where we perhaps are falling a little bit short and take that as like the baton to go and carry it on and make sure that we're improving for next year's rankings. Thank you.
I think it was about 6 years ago, I attended a lecture by a Harvard Business School professor talking about leadership and how organizations could more effectively get things done. And I wondered, what could I do in my position as Dean of the Medical School? So I did what usually happens at medical schools and universities. I formed a committee. But it was not a committee so much to look into things as it was to try and get something done. And one of the smarter moves that I've ever made in my career was to ask Dave Stewart to head that up. And Dave and I go back at least to 1970 something or other, and have a university in common, co-ops. And what we found, I think, early on in looking at this problem of how to get something done, how to move the bar as a community, we spent an awful lot of time in discussion because a lot of our students, staff, faculty, everybody was out there doing a lot of good stuff. A lot of volunteerism. And I think we wound up spending a lot of time discussing maybe the differences and similarities between people volunteering, and for the chemists in the group, you can sort of think of it as Brownian motion, you know, a lot of things just sort of moving, but in no specific direction. How could we get all of those forces aligned and pointing in the same direction so that if we all pushed together, we could get something done? And that's when the Community Service Committee was formed, and then Dave bit once again and became the first Associate Dean to head up that effort. Julie, I was struck by a couple things that you said in your remarks about what the successful communities had in common. One thing, because I'm a shy kind of guy, I didn't yell it out when you asked, that I noticed was that there were 6 women introducing each community. And I think that's a force to be reckoned with, and one that we have to tap into. The other force, frankly, that you mentioned was involved youth. And I think one thing that we've been able, you know, it's good to be a university professor. You're always surrounded by youth with their ideas, energy, and not knowing that some things may be difficult to do. It was easy for us when the medical school started 40 or so years ago. We didn't know that we couldn't do these things, so we just did them. And I think medical students and students in general bring that attitude and that approach, and it's valuable and we need to harness it. And the other thing that, and Dave won't be too pleased with me about this, but I really like your idea of setting the goal first and then providing or worrying about the resources afterwards. You know, Dave has been a chairman of the department for too long, and he's too smart to recognize that you need the resources to get things done. And yes, Dave, there is a Santa Claus and they're on the way. That's a promise. Yeah, right. But I think we do have incredible resources in this community, and it would just be a sin to not utilize them. And I think the key will be to avoid needless duplication. Reinforcing kind of duplication, that's fine. But if we can all decide what it is we're going to do and then get our forces turned in the same direction, I'm sure that when we have Julie back in another few years to applaud how we've risen in the rankings. Thanks very much.